Today I'll be demonstrating how to insert a Foley catheter into a male patient. The first thing I would do is review the physician's orders to make sure it's the right procedure on the right patient, and I would check for any patient allergies, and I'm going to gather my supplies. Then I'll enter the patient's room. I'm going to provide for privacy, and I'm going to perform hand hygiene. I'm going to go ahead and identify myself and explain the procedure to the patient, and identify the patient to make sure they are the right person. And after that, I would go ahead and raise the bed to a good working height. And I'm going to make sure there is good lighting, and I do have a trash can within reach right over here. Now I'm going to go ahead and expose the patient. And I'm going to put on clean gloves. After that, I'm just going to position his legs for a good position for this procedure, and I'm going to provide for period care. After that, I'm going to remove these gloves and perform hand hygiene. I'm now ready to set up my sterile field. I'm going to go ahead and put my sterile gloves to the side. And I'm going to take my blue drape and touching only the plastic side. I'm going to go ahead and drape the patient underneath the penis. I'm now ready to put on my sterile gloves. And I'm going to touch only the inside of the glove. Then I would reach this underneath the cup. I'm going to go ahead and take my cleaning solution, and I'm going to saturate the cotton balls with the cleaning solution. And after that, I will discard it. I'm going to go ahead and uncap my lubricating jelly and discard the lid. And I would uncap my sterile water as well and discard the lid. I will go ahead and place this on my sterile field right over here. And I'm going to get my catheter ready by removing this plastic lining. And I'm going to attach the sterile water to the port on the catheter. So I have that ready. Now I'm going to go ahead and, in an uncircumcised patient, I would retract the foreskin, and I would grab his penis, and I'm going to clean it using the saturated cotton balls. I'll take one of the sterile forceps, and I will start at the tip, and I will go one time around with the cotton ball, and then discard. And then I would do that a second time, and discard. And do that a third time, one time around, and discard. And I'll clean it as many times as needed. Then I'm going to go and discard my forceps. Now I'm ready to go ahead and insert my lubricating jelly. So I would go ahead and insert all the contents of that into the urethra. After I'm done with that, I will discard that. And I'm finished with this tray, so I will go ahead and get rid of that as well. I'm I'm going to reach over and grab my catheter. And I would instruct the patient to take deep breaths, and I would slowly insert the catheter. And I'll insert it all the way to the Y bifurcation. And after that, I would hold it in place and insert all of my sterile water. After that, go ahead and discard that. And then I would make sure to clean if it got wet anywhere, and I would go ahead and pull the foreskin back. And I'm going to tug to make sure there is resistance in the catheter. And after that, I'm going to go ahead and remove my sterile gloves. And discard those. And I'm going to perform hand hygiene. And I'm going to put on some clean gloves. And then I will go ahead and attach the tubing to the patient's leg using either Velcro or tape. And then I'm going to attach the catheter bag to the side of the bed, but not on the rail, so that it doesn't interfere with the catheter bag, and I'll make sure it's not touching the floor. After that, I'm going to clean up my area and take away all the supplies. And I'm going to cover the patient back up, make sure they are comfortable and cleaned up. And I'm going to remove my gloves. And I'm going to lower the bed and make sure a call light is in reach. And I will perform hand hygiene and document the procedure.